fate to send a kiss, but when darkness steals my heart away, it's you I beg to take my pain away. I cry and cry to have you rescue me, to end my time of misery.
Hi, Dr. Rick Barrett here. I'm with one of my patients, Felicia,
Good morning.
and we decided to do just a short video to show you some of the techniques in terms of hygiene that we're trying to do at the office here. I know a lot of people are very concerned about the virus, as you well should be, but I think that you can also take reasonable precautions. If you're having or experiencing neck pain, back pain, and all the usual things that we treat here at the office, some of our patients are staying home, understandably so, and some of our patients are still coming in. I just wanted you to see what we're doing at the office to take care of you. So this is one of the products that we use. We have lots of products. This kills all kinds of things like H1N1, E. coli, on and on and on. So with every patient, we're going to sanitize the table, especially the face piece, because that's very important as you breathe into this face piece. Of course, we want to sanitize the armrests and hand rests as well. Now I can wear gloves, or I can just use my hands. But in this case, I'm going to take my gloves off. I've washed my hands prior to coming into the room, but Felicia is armed and ready. So Felicia, if you'll sit for just a second.
Sure.
Okay. And so Felicia has chosen to wear a mask to protect herself and to protect me, and she's gloved up as well. So she's a fantastic patient of ours for several years.
Oh, thank you.
Well, it's true. And she felt comfortable enough to come down this morning and be treated. So, and she was willing to do the little video to help you guys to understand what we do.
I have no issue with coming here. They are sanitizing beyond belief. They're maintaining social distancing. I really don't even feel a need to wear the mask and gloves, but in view of the fact that they're asking us to be extra cautious, I think this is the responsible way to go. So I'm very happy to be here because my neck and my back are screaming. So be safe, take care, and come and see the doctor if you need help.
Okay, so we hope you guys feel comfortable with some of the things that we've been doing here at the office, precautionary measures that we're taking. And so we're going to adjust Felicia now. Do you mind if we
Not at
still
all.
videotape
Not
this?
at all.
Great. Okay, let's go face up for a second, Felicia. Good. Scoot down just a little bit. There we go.
You can tell it's tight, can't you?
It's extremely tight. You know, a lot of folks are having tension beyond their norm because of the stresses of today, right? So the emotional, chemical, and physical stresses that we're all undergoing at this point. And one of the nice things of working with the patient for years and just maintaining their bodies is that I'm very familiar with their spines, of course, and so we can pretty much go right to work versus a new patient where I have to get used to that person. But that's not to say we're not taking new patients, we are. But it would be a little different protocol than I'm doing right now with Felicia. Yes, wiggle your toes, relax. Good.
Ah.
How do you spell relief? That'll help quite a bit, as usual. Be a tiny bit of a stretch.
there more in there?
A little bit, especially there, on that left side. This might be a little harder on you, a little deeper. I'm going to drop this piece, angle the shoulders down. Relax, relax.
Oh.
There we go. I know you felt that one.
Yeah.
Tiny bit of a stretch again. Very good. Let's bring the shoulders back up. Very nice. Okay, Miss Felicia, let's sit you up and turn you over.
Yes, sir.
Good.
This part coming up is my absolute favorite part.
It's very important during these times that we continue to take care of ourselves as much as possible, which does mean still exercising, stretching, getting out and walking, perhaps taking some Epsom salt baths. Now you have to be careful with the baths. If you already have a lot of inflammation in the body, then those baths may actually increase that inflammation, so you have to be careful with that. But it is a great stress reliever. Okay, little breath in and out. How'd you feel on that one?
Oh, wonderful.
Good.
That's a bad area for me. It just locks up.
Yes. Good. Thank you. Shall we do a little stretch the low back today?
Sure, if you want to, yeah.
Okay. Okay, this part's going to be a little bit boring. We do what we call flexion distraction, which is a decompressive technique for the low back. Anyone that has degenerative arthritis, degenerative discs, sciatica, herniated discs, any of those type of problems work. This technique works very well for.
Oh, it feels wonderful. Oh.
Good. So listen, I'm going to keep working on Felicia a little bit longer. It's kind of boring to watch this part. So I just want to thank you, thank all my patients. We appreciate you. We love you guys. We want you to be safe. We hope you feel comfortable coming in. But if you don't, we understand perfectly. Keep using your nutritional supplements. Get lots of rest. And we're all going to get through this together, of course. And we'll see you either during or on the other side of this. And thank you, Felicia, for being willing to do this little video for me.
Thank you for helping me.
Okay, thanks.
With happiness, I rarely think to send a kiss, but when darkness steals my heart away, it's you I beg to take my